It's that time, guys. Are you getting ready for residency applications, but you're not sure? You have some questions? Stay tuned as we talk to two D4, yes, D4 dental students that are preparing their applications for residencies. Stay tuned. Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dentistry, surviving dental school, and getting into residency. And that's the topic of today, getting into residency, how to be prepared. Be sure to subscribe to the YouTube channel down below and hit the notifications as well. Hit both of those so that you are fully in tune and notified when new videos come out every week. Okay, today we're joined with my buddies, future DDS or DMD, depending on which school you go to. They go to Tufts, so it's DMD for them. And we're going to be talking about residencies and preparing for the residency applications and what to do. So, guys, want to introduce yourself again?
Yeah, of course.
Yeah.
My name is Tyrell, Fridie. I'm a fourth-year dental student at Tufts University School of Dental Medicine.
And I'm Tyler Brown, a D4 at Tufts University School of Dental Medicine.
So these guys just successfully completed their D3 year at Tufts, and usually as soon as you finish D3 and that May, June, July timeframe, guess what? Your work is not done. It is for your D3 year, but not for your D4 year. And one of the things that starts up immediately is preparing for applications for residency. And these guys have made the decision, which I applaud 100%. I think everyone should do a dental residency, just for that 1 year. And we can talk about that as well. But just for that 1 year, it's so much stuff that you're going to learn and how you're going to grow as a clinician that you wouldn't necessarily think you will. The things that you're going to experience that 1 year out as a resident is going to be different than how you process things in dental school. So I'm glad you guys have made that decision to get that post-grad, postdoc training. So let's talk a little bit about residencies and some questions that you guys have, and we'll kind of jump into it right now.
Okay. So first and foremost, thank you for your time.
Thank you.
Whenever we thought about, applying to residencies, you were the first person who hopped into our mind. So, we're excited. We're excited to ask you a couple of questions. But first and foremost, we're giving this option a lot. And, in the perfect world, everybody says, hey, I don't want to do a residency. Instead, I'm going to go to a private practice where I find a mentor who is willing to really sit down with me and teach me certain procedures that I don't know, and kind of get that real life experience versus me going to an actual residency. So we wanted to ask you, why do a residency versus us going and finding a private practice who has a doctor there who will mentor us individually?
Well, that's easy. The first thing is not everybody is a mentor.
Okay. I mean, yeah, true.
And not everybody's willing to mentor. I think that takes a special talent, and it also requires a relationship that's building on sharing and knowing the mentee and the mentee knowing the mentor.
Mm-hmm.
Not to say that it can't happen. It's just that not everyone kind of fits that position,
mm-hmm.
right? Also, you've got mentors in residency programs, the attendings, right?
Very true.
So think about that. They could be a mentor, and most of these residency programs, you're still going to be making money,
mm-hmm.
right? It may not necessarily be the money that you're going to make. It won't be the money that you're going to make in private practice, but that 1 year of residency or 2 years of residency as a general practice resident or AEGD resident, you'll learn some things that may actually save you some money in exchange for not commanding the same salary that you would if you're in private practice. Those experiences that'll save you some heartache and possible having to do, you know, some redos that's going to cost you time and money. And if you're in a private office, you know, if that patient has to come back multiple times after you seeded something, you don't get paid on that procedure anymore. If you get paid once, that's it. Or you get a percentage of that procedure, that's it. Now you are spending time redoing stuff that you could be spending time producing services. And that leads me to the fourth point, which is in private practice, it is about production. Yes, it is about delivering services and providing oral health care, making sure people are taken care of, but it's also about production. And if you are an associate in an office, that means that owner that hired you probably has enough patients that he or she has their own set of patients, and then now you as an associate have your book of patients, or you're developing your book of patients. He or she may not have time to be helping you through stuff when they've got their own book of patients that they need to deliver services for, right? So that potentially can take away time from him or her chair side to help you, and that's a slower process. One of the things that you all will find when you go into private practice is that either you're going to be paid a per diem, or you're going to be paid a percentage of what you produce. So of course, the more that you produce that's collected, the more of that percentage of that production you receive, right? So the emphasis is on production, and not necessarily always on mentoring, where you're able to maybe attempt and do different things, and it may not. You definitely have the ability to fall back on the attendings and the other mentors within the residency program for support and learning as well. And don't get me wrong, there's people that are just as successful not doing a residency as those that are. I think it's a personal thing, and but also it's an awareness thing, because you don't know what you don't know.
That's true.
Until you get in a situation where you're like, oh, I don't know what I'm doing here. And you typically do, you know, you want to mitigate those types of experiences once you're in private practice. And that's where I think a residency is a great platform to continue learning. I mean, you know, our profession is such that it's one that's part of lifelong learning. And even in that 1 year of residency or 2 years of residency, you're not going to learn everything that's going to prepare you for every situation in private practice. It does not work that way.
Right.
But it puts yourself in a better position to be able to ask certain questions and to continue to troubleshoot and work through certain types of treatment plans that you may not feel as comfortable handling right after dental school. Does that help?
No, it
does.
It does. It does.
So, I was gonna say, I just have a quick question about, like, you know, a lot of people always say, and similar to what you were saying, it's just like the experience, the exposure. I hear a lot of dentists, you know, joke that you don't become a real dentist until 5 years, like 5 years after you get out, because that's when you really start to become comfortable with the pace and handling more complex cases and everything. You know, and between like an AEGD or a GPR, somebody who's not trying to specialize, I guess, what would you suggest, or what have you heard or seen from residents who've done a GPR versus AEGD, you know, jumping into more of a private practice setting, you know, or versus a DSO setting? Like, I guess the transition from one of these residencies into actual practice. Like, what are the benefits of a GPR versus an AEGD? Maybe, you know, actually transitioning into, you know, practicing on your own. Does one have, I guess, like a faster track to opening up their own practice? Does one have a better chance of just being more productive within a practice? Like, I guess, what is your mindset on the two?
Well, on the two, I mean, you've got similar residency programs, but they also are different. right? I think AEGDs are a little bit, continue to be a little bit more clinical based.
Okay.
Where GPR programs probably are more based clinical, and also the medical component of your patient, and some training on how to treat patients in a hospital setting.
Gotcha.
All of which you are responsible for in private practice, whether you've done an AEGD or GPR. You know, we are entrusted with the health of the patient, and they don't know if you did an AEGD or GPR. They just need to know that you're going to take care of them, and be aware of their any underlying medical conditions that can cause some compromise in you providing dental care, right? So I think there's more of that inference. There's more of that reference of the patient as a person as it relates to medical histories, and treating them with conditions that are more, maybe a little bit more challenging than you would with a typical patient who's maybe doesn't have as many medical history. His or her medical history is pretty much like a clean slate.
Gotcha. Okay.
I will also say that depending on the programs, and this is where it's tough to kind of have some discernment and being able to understand what programs offer what. I say that because information that you find out about programs sometimes is, right now when you're going through the preparation process, is really limited to what you see on the website,
right?
Which can be a challenge. Unfortunately, that doesn't give you the nuts and bolts and nitty gritty about what's going on in the program. You've got to speak to residents, former classmates, former people graduates of Tufts that have gone through residency programs. And I think ASDA may have a resource. At least I know they were thinking about creating one. I know I was on that pathway, was working with them on creating like a more of a database of residency programs to kind of get a more in-depth look into each and every residency program based on what you don't see, what you don't know, what's posted on the website. But I will say that typically, I think, depending on the program, you will get probably some of the programs, you'll get more implants. There are AEGD programs that are very implant heavy, but also there are some GPR programs. Even in New York, I know of a couple that are have a somewhat of an emphasis on implants. So when you're looking at these different programs, you have to also look at where your strengths and weaknesses are. You also have to look at, well, potentially where you want to live or where you're thinking about living, right? And you have to really think about what type of dentistry you envision yourself practicing. You know, if you're thinking about implants, you know, and you want that more hands-on experience, maybe an AEGD may be the best route if you have the right program. But also keep in mind that it's lifelong learning. 1 year of an AEGD program or 1 year of a GPR program that has an emphasis on implants doesn't necessarily mean that you are proficient, ready to place implants, and more importantly, able to troubleshoot if you have issues. Mm-hmm. You're still gonna, I mean, I've got classmates, I've been out over I've been out 20 years now. And about 10 years ago, I had a couple classmates that have been out 10 years that actually took like a 1 year implant seminar, maxi course. And they learned, of course, more in that 1 year of that maxi course than they learned all of dental school and even in residency. Mm-hmm. So I'm saying that to say that even a residency that has an emphasis on a particular area that you like, you're still going to need to get some more training. And I know implants is a popular procedure that everyone wants to be proficient. And they think if I go to a residency, I do implants in residency, I'm going to be proficient. Mm-hmm. Yeah, it depends on the cases that you have.
Right. Yeah.
You know, So I think those things are key in determining what type of program. I've had people do both. I've had people do an AGD 1 year and a GPR the next year, or vice versa, just because of what they were looking for in that additional training. And again, GPRs will give you probably a little bit more, like I said, of a hospital-based setting, especially for any people that are thinking about maybe working in the public health, a dental public health setting at a fairly qualified health center, FQHCs, those type of settings kind of more or less will mirror more of a GPR program as far as at those centers. There's usually dental is co-located with medical and everything. So there's more abilities to connect with other and getting consults with other medical professionals that is somewhat similar to what you'll have in a GPR or hospital-based program as well.
Gotcha.
Those are just my thoughts. But you also mentioned something about getting prepared for, which one's going to prepare you for private practice as far as the business of dentistry. The business of dentistry really is predicated on what you are willing to learn about the business of dentistry, right? There are some GPR programs that have a private practice feel, and then there are some AEGD programs that have a private practice feel, right? And in both of those situations, you'll be able to learn about, you'll be able to translate some of the things that you're learning in those residencies into private practice. But it doesn't mean that it's a natural, you-know-it-all type of transition. You're still going to be doing the things that I know you guys are already doing, which is learning on the side about the business of dentistry. And unfortunately, still, there's still not enough education in dental school to really address this big gap that we have, because we're being trained as clinicians. We're being trained as technicians in clinic. But the reality is, once we graduate and once we finish a residency, what does everybody want to do?
Be a businessman.
Be a businessman. They're going to be an entrepreneur. They want to open up their office. They want to open up multiple offices.
All right.
Many of which those types of procedures or those types of that knowledge of how to do such, it ain't in dental school. You'll get a small part of that as part of the curriculum, as part of the accreditation standards. You get a small part of that. The bigger chunk is the technical part, right? So even if you do a residency either or, you're still going to have to dive in deep into learning more about the business of dentistry, whether you do a GPR or AGD or not. You're still going to learn some aspects of it in both of those residency programs, as far as scheduling of patients, some of the insurances, dealing with staff, working with staff and people on your team, all of which you have to be able to translate directly into private practice. So I think it kind of balances itself out. AGD, GPR, they both, depending on the program, and that's what is so key. Depending on the program, you could get, some of the things that you would get in the AGD program, you may be able to get in the GPR program, depending on the program, and vice versa as well.
Gotcha.
So how crucial do you think that it is that we go to a program in the same state that we would eventually want to practice in?
I think it makes it a little bit easier once you start to transition out of your residency.
But it's nothing like critical.
There are some residency programs as a first-year resident that you're able to do some moonlighting, right? And that was actually one of the things that I did when I finished my residency and joined the Air Force. I purposely went to a site in Las Vegas because there was an opportunity that I was looking at in Las Vegas. And even though I knew I was going to be in the Air Force for 4 years, I still wanted to see what that area, what that city, what the dental landscape was like. And best way to do that is to live in the same city where you're doing a residency or some military training or whatever. So that was helpful for me. And I think you can utilize that for, to your advantage. And it's going to work out one or two ways, whether you'll be able to moonlight and see what the landscape is in the area. And you settle there. And then also it can be helpful. You're like, I don't like this city. I don't think this is where we're setting up, but we're not setting up here. I don't know if I want to do that. I don't know. Right. So I don't think it's crucial in the sense that you must know exactly where you want to live and do a residency there. But I think it is something to consider as you're looking at residencies. But again, you got to just be open to where the opportunity is, because you may look at, oh, I want to go to Florida, or I want to go back to Atlanta or something. I'm gonna do a residency there, and you may not get into that program. Mm-hmm. You get into a program in LA, you get into a program in Texas. So the best program for you is the one that's gonna train you. Right. So you go to that program, you suck out, extrapolate whatever you need from that program, and during that residency, you're also going to be, exploring the notion and the locations as to where you want to possibly set up. Okay. And so, with you have spoken to a lot of people who have done residencies, we always hear another rumor of, what's a good residency versus a bad residency. And so with you having experience within the field, we wanted to kind of ask you, what are some red flags that we should look out for with regards to considering residencies that will probably just be like, okay, this might not be a good one in general? Well, I think one of the first red flags is that if they tell you can't come visit the program, right? You need to come and visit and go visit the program. Even if they say, well, no, we don't typically do that. Great. Well, I'm not a typical person, but I need to come see the program. Yeah, right. And it's true, because you need to talk to the residents. You need to see what it looks like. Again, unfortunately, what you see on the website does not represent what you see in person. And last time I checked, when you are at a residency, you're not looking at it you're not there on the website, you're there in person. Right. For 365 days, you're there. So you need to kind of be there to get that experience and see and talk to residents, talk to the staff, whether it be attendings, but also those on the administrative side as well, because those people are going to be key. Those people are key for your success and your development during your residency years. So I think that's one of the first red flags. Another red flag deals with, I think it ties into what we were talking about, not being able to go see the program. There are some programs that have more of an emphasis on an emergency care versus comprehensive care. And there are some residency programs, and I'm talking a little bit more about GPRs more so than AEGDs, because AEGDs, the standards are similar, but a little bit different. Not that much different. But also there are some programs that have an emphasis on surgery, right? On surgery. If you're thinking about GP and you're not necessarily wanting to do a lot of surgery, like oral surgery, that means there's probably less comprehensive care than there is surgical care. So not being able to see what the true mix of the residency program is like can alter or really affect your success in the program. I mean, I've heard stories where residents have gone to a program, they went for a visit or they went for the interview, maybe did or didn't talk to residents that were currently there. And I've had candidates say, yeah, I went to ABC GPR program, and the residents were in the other room looking at me going, don't do it, don't go, doing that kind of stuff. And when that happens, yeah, that's a red flag.
Yeah, take heed.
Take heed, quick. Take heed, and maybe try to be like, I need to talk to you, outside. Let's talk and find out. And when I did kind of survey a couple of those people that shared, some of those candidates that share that information, that's what they said. It's like all we're doing is emergencies, or we're always on call, and the call schedule is X, Y, and Z. All of which are red flags for a program. Not to say that all programs are going to be perfect and you're not going to have somebody that has some complaint or some grievance or something that they don't like about the program. But as far as the content and what you're learning, if it's focused in an area that only in one area and you're trying to get more of a comprehensive base of training, that program could be a red flag. Right. I think those are the two that really stand out. Okay. I think there's some more. I'll let you know.
Okay.
Yeah. And also, I just point back to the fact that it's real important, I think, that you really have to do your due diligence about the programs. Yeah. And again, unfortunately, there are some dental schools that have affiliation with programs where they have maybe a rotation at a local residency program. That's helpful. Again, any type of school-based groups that have maybe a database. I think there was somebody that was working on a database down at the University of Florida where they had graduates send back information about their residency programs. Mm-hmm. And that might be a project you guys and I might want to try to work on as well. Because there's just not a lot. The information that's available for dental schools is not necessarily the same quality and quantity than there is for residency programs.
Right. Okay. And so now let's talk the application. How can we be a successful applicant? And of course, we know that, better grades, better chances, whatever it may be, but we're looking for, advice,
I think
what else?
And I think it's kind of, I guess, a unique perspective just because, like, the times right now, obviously, like Tyler explained before, we weren't necessarily ideally looking at a residency at first. So, trying to pick up all this information and everything, I think that would be a good place to kind of take it.
Well, keep in mind, there's many parts of an application, right? Typically when you think about residency, you think about a specialty residency. Years ago, the main thing was, GPA, board scores, and of course your grades in certain classes, depending on the specialty. Right. Well, I can't remember, but are you guys pass fail?
No, we're not.
Okay. So there's schools that are pass fail now. So that means there's no grades, there ain't no GPA. All the national boards is pass fail. There's no grade. When I was in dental school, there was an actual number that was assigned that was utilized as a screening tool. And what else? There was something else. But anyway, so those are the credentials, those are the numbers, those are the stats, right? Which have its place, but just like dental school, where you're going to be at the institution for 4 years, you're going to be at these residencies for 1 to 3 years, depending on what it is. And at the end of the day, the grades don't mean anything, don't serve a purpose if you as the person are crazy or they don't know you as a person.
Yeah.
Because each and every day for at least 8 to 10 hours for 365 days, they're going to be with you as the person.
Yeah.
They're going to be with Tyler Brown, Dr. Brown as the person. They're going to be with Dr. Tyrell as the person. So I think that part of the application needs to be massaged so that they want to get to know you as a person. And I think the best way to do that is in your essay. That's one of the ways to kind of draw that attention. Mm-hmm. I think your essay, your personal statement has to be, of course, be personal, but it's got to stand out. Now, keep it in mind, over the last 7 years as a program director and having gone through 100, at least 100, if not more than, probably more than that, over 100 applications each year. Each application has an essay, has a personal statement. So you do the math.
Yeah.
After a while, all the essays look the same, man.
They start looking at
They start looking the same. And guess what? Your essay gonna look the same too, unless it stands out. So I think being able to tell a story and leading to points that make you unique and things that also add value as to or also demonstrate how you're going to add value to the program, right? Because it's more than just like in dental school. I pay this money, you're going to give me this degree. That's the exchange. Well, in the residency program, you're getting paid. They're also teaching you. But you know, what else how are you going to contribute to the legacy and the mission of what the residency program is about? Because at the end of the day, when you're done on the 365th day, you're gone.
Yeah.
The residency still it goes on. Those patients that you saw that were part of your treatment plan family, they're still there. So how are you going to impact and contribute to the residency program? I think that needs to be communicated. And I think the personal statement is probably one of the best ways to do it, because everyone's going to have grades, or they may or may not have grades. You know, those things, you rank where you are in the class. But I tell you, man, I wasn't ranked in the top 10 or top 50 in my class. That ranking has nothing to do as to who you are as a person and what success that you're going to have after dental school, after residency. Means nothing. Means nothing. I remember people top in my class that clinically, you know, you sit down and have a conversation with them. You're like, you want to be a dentist? You going to talk to people and you're not talking? Wow. Good luck with that. So, you know, I think that the personal statement is just that, a personal statement as to who you are and how you're going to contribute to the program. And that means you need to know about the mission and the purpose of that program. You know, again, just because it says GPR and all the programs are accredited doesn't mean all of them are created equal. They have different focus, different meaning to the community that they serve. You know, whether you're in a community in New York that's in one of the toughest neighborhoods or one of the neighborhoods that have the most challenges regarding the social determinants of health, or if you're in a more affluent neighborhood, that the purposes are going to change, and what that hospital or what that program means to the community is going to be different. You got to find that out, right? And one disadvantage about the essays, I think they might have changed a little bit. Your essay that goes in, I think now with the process, you may be able to have two different ones, but I couldn't remember if it was one for a specialty program and one for a general residency program. So you have to kind of make your personal statement kind of broad, but you also have to kind of tailor it to the programs that you're applying to. So that means if you got 10 programs that you're thinking about, then you need to dive in to find out what the common theme of those 10 programs are, so that you can kind of tailor your personal statement to those programs. Right. I think that's one of the successful actions that will help you kind of stand out in the application process. And again, another part of it is part of your application is going to visit the program.
Yeah.
That is part of your application process, because again, imagine having a desk high of folders like this. You have 150 applicants for 40 spots or 30 spots. You are really just one of those files, but you're really not. But we don't know that. We don't know that until we see you face to face, until you come and you do and you're willing to do something that most people won't, which is make sure you get the face to face communication. Because most of us are not answering emails. And hopefully now some programs have started to change their websites so maybe it's a little bit more interactive, or they have some type of Zoom or video, kind of talking about their program. But if not, you're going to need to kind of interact with them where they are, and that means going to visit. And I think that's what people will remember. And now that allows your application to pop out.
Yep.
Or at least when their application does come, I'm looking for Tyler Brown. Yeah, he came in last week. He said he submitted it through Pass. There it is. Boom.
Mm-hmm.
Right? So I think those are the things that kind of stand out in the application process that you definitely have to understand how that process goes on the other side.
Okay. Okay. Do you have any more questions?
I don't have anything on top of my head right now.
Okay.
You guys look funny. You guys are like, I can see the smoke coming out. Like, what else?
Because we want to take advantage of this, but you did, you definitely broke down a lot. I think like these questions come into our head as time progresses, as we continue to go through the application process.
Yeah.
And it's every day is a new day.
Yeah.
And things are changing so rapidly now.
I guess I do have a question about, like timing of everything.
Does timing matter?
I know like a lot of dental, obviously dental school is predicated on, almost being the first to push that submit button. Is residency more so, are they predicated on waiting until they get their full list of applicants they want, or are they kind of like dental school, going to pick the best ones that come in first?
I will tell you, unfortunately, it's a general statement. It depends on the program.
Gotcha. Okay.
Now, I will tell you, if we're talking more about specialty programs, they want those applications like as soon as it's open within the first hour. The sooner the better, because that cycle for them is much quicker.
Mm-hmm.
And for a lot of those specialty programs, especially like oral surgery, ortho, endo, they're looking for reasons to weed you out.
Okay.
Because there's so many daggone applications, right?
Yeah.
Let me add pedo to that too. Pedo, ortho, and oral surgery are probably the top three right now, especially pedo. So, so for GPR programs and AEG programs, it just differs on the program, right? Because it depends on how many positions there are. It also depends if it's match versus non-match.
Okay.
Some programs are not part of match where they have to submit a list of candidates that they want, and then you as a candidate have to list or rank a list of programs that you want to go to. And then that happens in December, and then January, 30 days later, the list comes out. There are some programs that are not part of match. What they do is they have what we call rolling admissions.
Mm-hmm.
You may go for an interview in July or August, and they got 10 spots, and they may offer you the spot on the drop of a dime.
Mm-hmm.
Okay.
And maybe only give you a week to respond. If not, you say, I got some other program, got some match programs I'm looking at. You may be like, I want to wait until I go to see some other programs. They're like, cool, next.
Yeah.
And then maybe when you do circle back around them, you may, they may have already gotten their 10th person.
Right.
But that's another thing I was going to say. Please be sure to stay in communication with people, because you never know what happens during the process, especially both for match and non-match. You've got, for non-match positions, you've got people that say yes and then change their mind. right? But you won't know that now the program that you liked that offered you a spot 4 months or 2 months ago, that they've got a slot. They got 1 or 2 slots now. You won't know unless you're staying in contact. And program directors may not be as active as far as staying in communication with you.
So you're saying stay in contact throughout the process, but then especially you might want to send out, if you did get into the program that you wanted to, you might want to send a hello email, after the match day process happens.
Yeah. I mean, especially for the non-match positions, because again, you just don't know what happens. Some people say yes today, and something comes up, and a month later they say, you know what, Dr. Hayes, you know, I made a decision. I'm going to go in this route, and if they need to fill that slot, it's easier for them to fill that slot with somebody that they know that they've been in contact with.
Right.
I call up and say, hey, let me check out with student Dr. Brown. I know he was interested. Let me see if he's still interested a month later, and you give him a call. Some program directors do that, some don't. But you want to put yourself in a position so that if that comes up, you want your name to be on the tip of their tongue.
Yep.
And the top of their mind, so they can be like, yeah, let me call Dr. Brown. Let me call Dr. Fridie. Yep. So that's the advantage of staying in contact with people. And best way to do it, email is fine, but guys, you know how it is. I got 1,000 emails in my inbox.
Yep.
Every day I go through 200, and then I get the next day I got 200 more. Folks they're checking the email, but they ain't checking the email.
Yeah.
You know, you gotta send one of these. You gotta send a card. That's my advice. That's the tip I always tell people. You gotta send a card as another means of communication, because everybody ain't doing it. Probably people start doing it now that they hear us talking about it. But again, another way to stand out. Everyone sends an email, and then everyone says, hey, Dr. Hayes ain't gonna get back. I never heard back from the program. Well, shoot, Dr. Hayes get 3,000 emails about the same thing. But if you send this, and he gets that in the mail, or the program director, she gets that in the mail. Oh, send a card. Okay. Who? Tyler Brown? Okay. Put it in a separate file over here, you know.
Keep that name fresh.
Yeah.
Your name fresh.
Your name fresh. You guys know the deal of how to make sure that you constantly engaging and staying in front of people, because you never know when they're going to say yes, or you never know when they're ready, or you never know when they need to call on you and say, hey, I got a spot for you. Are you still available, still interested in the program? And that leads me to the match programs. The match programs are even worse, in the sense that match day comes in January, and then some programs, and this has happened to my program, where we've got 40 slots, we may only fill 30. So now we got 10 slots we got to find. We got to find people who we thought were interested, maybe didn't match with us, or you have students that didn't apply through match and are waiting for post-match positions, and then that's when they apply, right? And that happens all the time, especially when people change their mind about residency programs, when they're already into halfway of their D4 year, and they're like, I think I want to do a residency program. Well, they missed the match, they missed the non-match programs, they missed the interview process. So the only way they can get in now is via the post-match process. Okay. So even then, you will have program directors, and I've done it, did it for 7 years, on basically an email and phone call frenzy, calling people that either we've interviewed or new people that faculty at the dental school is saying, hey, I got these 2 candidates from Tufts. They weren't thinking about a residency, but they're thinking now, do you have any positions? Yeah, I got 10 slots. Yep. I'm interviewing everybody. Let's go. Send me their stuff, or have them get in contact with me. Or if you've gone through the match process and you don't match at the location where you want to be, then now you are in the PostMatch pool. So now you're looking at open slots at different programs, whether it be in California, Texas, Florida, Georgia, wherever. And now you're looking through, just like the program directors are looking through to see who they interviewed still hadn't matched and to see if they're still interested in the program. But that's why that's why you have to have some mode of communication with program directors and with programs, especially the ones that you're most interested in.
Okay.
Makes sense.
Okay.
Does that help?
No, definitely. Networking.
Networking.
That's all it is.
Down to the keys.
Right?
Putting that energy out.
Your net worth is based on your network.
Exactly.
Or your most successful actions are going to depend on who you look to be successful with or who you know. I mean, that's part of the way that America was founded and continues to exist, I should say.
Yeah.
We'll leave it at that. But yeah, network. And that's how you network. And I think right now it's very easy to send the email, send the text. But everyone does it and everyone gets it. Yeah. So how are you going to be different? That's the question of the day. What are you willing to do to be different so that you get in front of somebody and they get to the point where they're able to see you differently from that stack of 100 applicants and files that they get.
Right.
How does your file pop out and show up so that they can open it and look at it? That's I mean, again, if I had to do things differently, those would be the things that I would consider in this process, because the process has pretty much stayed the same over 20 years. What is different is the people who are part of the process, both on the applicant side and also on the residency program side as well. The people have changed, but the process is the same. So you still got to figure out how to stand out to get your face and your application to pop out of that list, of that file.
Okay, no, that helps a lot for sure. And like I said, I'm sure we're gonna have a lot more questions for you.
Definitely.
I mean, we'll shoot you a text now. I guess. I mean, should we give you cards? I don't know.
Yeah. Well, if people are listening, they got some questions, they can shoot me an email at newdentistcoach@gmail.com. newdentistcoach@gmail.com. You can also check out this website right here. We just put up DrDarwinHayes.dds.com. It'll take you to a landing page with some resources there. And then also some of the stuff that we're talking about, I've had similar discussions with other former residents, whether they were students, whether they were applying for GPR programs, AEGD programs, or even more competitive are the specialty programs, right? Oral surgery, a lot of pedo, and also ortho. And those are some of the things that I've had conversations and interviews with former residents and now who are now orthodontists, who are now endodontists, who are now oral surgeons, who are now super GPs, and some of the tips that have helped them kind of navigate this landscape. So I hope that's been helpful for you guys. A little Q&A with Dr. Darwin about preparing for residency. If you guys want to hear more, if you have any more questions, like I said, shoot me an email right down here at newdentistcoach@gmail.com. newdentistcoach@gmail.com, and we will try to get those, maybe even get you on screen, and we can do another Q&A like we've done with future DDS. So guys, take care. Check out this next, I don't know, it's probably going to be right here. Check out this next video, either here or here. It might be both places. Check those out, and we'll see you on the next video. Peace, love, and smiles.
All right, y'all.